So I'm Chandler Christoffel. I'm a user experience librarian at UGA Libraries. Welcome to our panel, which is on the topic of COVID-19 fact-finding, journalism and research during a pandemic. And it's a virtual conversation with the Red and Black. A little bit of a background about how this all started. So at the end of the summer, as we were approaching the fall and getting ready for the fall, some of us in the libraries were talking about what an amazing job the Red and Black had been doing of covering a lot of stories, both local, state, national, from the protests and racial justice issues following the murder of George Floyd, to election obviously coming up, to COVID-19 stories. It seems like these days everything really is a COVID-19 story in some ways. And we were just so impressed, and we thought, as professionals who are really invested in helping students become savvy researchers and information literate citizens, how can we talk to Red and Black student staff about their experience with all of these issues, and what can we learn from them, and how can we share that conversation with the wider UGA community? And so we kind of reached out to the Red and Black, and we got some great student panelists with us. Interestingly, as a librarian, as somebody who works in libraries in the higher ed context, I tend to have the academic lens about research. However, it's also important to realize that research takes many different forms and disciplines, and journalism is its own sort of research paradigm. And so we thought it'd be really cool to look at the interface of journalistic research and academic research. And that's why we have also a faculty member with us to kind of bring in the academic context, the pedagogical context. And so that's why we're here today. And what I wanted to do is introduce everybody and talk about format, and then go ahead and get started. So with us today are Matt Pulver, and Matt Pulver works at Access Services at UGA Libraries. And in addition to that, Matt has done a lot of journalism and writing with such channels as Flagpole and Salon, Alternet, and McSweeney's. I think I didn't realize you had written for McSweeney's too. And so Matt will be doing a lot of the heavy work of moderating this discussion with our panelists. On the student side, from the Red and Black, we have Megan Mittelhammer, who's a news editor. And we have Sherry Liang, who's an in-depth special projects specialist. And we also have Stroud Payne, who's a data specialist. And I take it that these are your current roles this fall, but in the summer, you also had other responsibilities, some of it actually doing some editorial as well, to reflect possibly a different staffing situation over the summer. So you've got a lot of experience under your belt. And in addition to our students, we're pleased to have with us Professor Sabriya Rice, who is the Knight Chair in Health and Medical Journalism. Unfortunately, Dr. Bagwell Adams couldn't make it this afternoon. But the good news is, if you want to hear her talk, she's on NPR all the time. I always hear her on WUGA. So if you check out, News Matters, you'll be able to hear her as well. Okay. So, and a little bit about the format. So this is going to take an hour. We're going to be done before 5. It's going to be a discussion moderated by Matt for about 45 minutes. And with the remaining, 5, 10, 15 minutes that we have, we're also going to be allowing y'all an opportunity in the audience to submit chat questions. So if a question occurs to you that we're not really asking or answering, feel free to put something into the chat through YouTube. And we're going to be kind of moderating that and fielding that at the end. Before we pass the baton to Matt, I also want to give a special shout out to Ian Thomas and Amy Watts, who are research and instruction librarians at UGA Libraries. They've done a great job kind of helping us get all this going and coordinate it. All right. So without further ado, Matt Pulver, it's all yours.
All right. All right. Let me start with the journalist, or the student journalist. And sort of as Chandler said a little while ago, my feeling is that, librarians and journalists are sort of doing the same thing under different names. What we in the library biz call information literacy, y'all would call, whatever term you have, journalistic accuracy or integrity, or, but it's the, information literacy for us is it's the skill in locating information wherever it can be found, evaluating it, thinking critically about it, determining its veracity and relevance, and then delivering it. And for us, delivering it to patrons, researchers, students, what have you. And for y'all, it's delivering to readers. But reporting on COVID-19 strikes me as altogether different. And I might be wrong, but I don't find an analog in the library world for the sort of reporting that y'all have been doing over the past, 7-8 months. So that's really just a long-winded way of asking, what has it been like? How different is it from what you've done in the past and what you've sort of learned about, in the academic side of journalism? What has this been like for y'all?
I can go ahead and start. So pretty much it's been constant. And we know that the news does run 24/7, but every story, like Chandler said, has a COVID angle. And it's been just a matter of reporting virtually, which is something we don't do. We're journalists, we're active, we get out into the audience, we go places, we meet with people, we interview them. But we've really had to take a step back from that. Starting with this summer, our entire staff was virtual. Normally we meet in the office, everyone's living in Athens. But this was the first time moving to a completely online format and making sure our staff were all on the same page. We met 3 times a week over Google Hangouts, constant phone calls, emails, Slack messages. So the format of reporting and then how we worked as a staff changed as well.
What about Sherry and Stroud? How has it been for y'all?
It has been pretty constant, like Megan was saying. We update our coronavirus numbers for the state and for the county every day, and then for UGA now we update once a week when UGA releases their numbers. So I've been updating the website with that every day since it was either late May or early June. I know Sherry was doing it before then. But yeah, it's just something to where, there wasn't much background to look at. We kind of had to learn on the job. And so that was challenging, but I think we've gotten it down since then.
Well, yeah, y'all have done. Go ahead, Sherry.
Sorry.
No.
Yeah, I was just gonna say, I think too, something that people might not realize is that we're also full-time students. So kind of going through that spring break debacle of USG reversing its decision and us kind of also being in limbo and not knowing whether we're returning to school and the rest of the spring semester or fall semester even. So it's been really interesting, and especially in the first part of the pandemic, at least during spring semester, especially in the beginning, not many of us knew what was going on. We were hearing the first reports of this alongside national media outlets. So it was really maybe a little bit stressful in the beginning. I think the news desk is doing a great job right now, keeping up with everything. And obviously we've kind of established a bit more of a structure to things, but I think especially in the beginning when everything was so unknown to everybody, it was difficult to balance that as a student as well, but it's definitely become a little bit more manageable. Yeah,
that strikes me. That's another thing that strikes me is very different about y'all's work, during the pandemic. That, it's not, how did it feel to be reporting on things that aren't in the abstract? If you're reporting on, campus or campus admin or county government or whatever it would be, before COVID, I could see how that would be sort of in abstract, right? It doesn't affect you personally, but then y'all found yourselves, reporting on things that that would determine, theoretically, whether or not y'all were going to be, doing in-person classes, whether or not they were going to shut the dorms down. to say nothing of suddenly finding yourself perhaps in an antagonistic relationship sometimes with campus administration. Yeah, if any of that hits home for y'all, could speak about like how you're reporting on something that is very present in your life, but then you also have the job of reporting to the to the campus community.
And I think that's something that we balance every day, or try to, especially this semester, because over the summer, we gained a really heavy social media following. That was one of our main takeaways from the summer. And that's because so many people were away from Athens, but they wanted to keep up with what was going on because it was impacting them for the near future. And it was also impacting us, even though we weren't in Athens. So it's trying to balance how we reported, knowing that what we were reporting was determining how the university, how students would decide whether they came back to campus or not, whether they decided to stay home or rent an apartment versus living in the dorms. And we were getting that information like rapidly towards the middle of August or beginning of August, like right before school started, which is when we normally take off like a week and have a transition between summer and fall. But that really was non-existent. We just kept on plowing through because we knew that that information was important for us to get out so that the community could have it before making decisions on the fall semester.
Mm-hmm. Did y'all encounter then, now, or before sort of a did you feel that you had to not toe the company line, but what is the struggle when you have some messaging coming out of campus administration or state government that y'all have countervailing evidence for, or whatever? What has that been a struggle to find yourself sort of literally speaking truth to power in some cases?
It has in some cases. What we try to do is find the numbers, find the science and the facts behind the information, and then get opinions from the county, from the university, and decide like what are they doing and how is that relating to what the scientists are saying, what the facts say, what the numbers are currently reporting, because it ebbs and flows, and we find out the information basically when the university has that information. And sometimes that's longer than we would like. Sometimes they know and they're able to let us know pretty quickly. But because things are changing so rapidly and constantly, it's just a matter of keeping in constant communication with them to make sure that we're on the same page so that we can report what they know when they know it to the community.
This might be a good time to bring in Professor Rice, who at CNN and elsewhere has a lot of experience communicating these sort of complicated things to a broad public. If Sabriya, if you could share some of your wisdom on these sorts of difficulties. We might not have
trouble hearing you. I think you might be muted. Sorry about that.
I apologize. I am unmuted now. I would start with just saying kudos to the Red and Black, because I would agree the reporting has been extraordinary under exceptional circumstances, and that's hard to do for any newsroom under these circumstances because, maybe since the early 1900s, we haven't seen a situation like this. So I would just say what the students here are experiencing, I think reporters across the nation have also experienced, trying to kind of switch gears in the middle and knowing that your job as a journalist is to get out there and to boots on the ground, find and tell the stories. But that became a challenge even for reporters who were worried about protecting themselves, wearing masks and being socially distant while out there trying to get the story. From a health journalism perspective, I think it's an interesting case study that we're experiencing in real time, and why I think every journalist should do a little bit of training in health and medical communication as part of their training. I think it was Megan who mentioned kind of every beat had a health or science angle in the past 6 or 7 months or so. I kept track of that myself from no matter what beat you were on, transportation, sports, business, food, culture, there was an angle related to COVID-19. And one of the challenges with reporting on that is kind of giving up your fear of being afraid of numbers and science, and having to delve in and actually look at research and question research and counter kind of what has been told to you sometimes. So I'd say kudos to the red and black reporters, because that's really hard to do. But the challenge that they're experiencing is global, I would say, right now.
Yeah, Professor Rice, you touched on something that to me is central, and especially early on in the course of the pandemic, where, I think in an earlier era of journalism, we would have collectively agreed on the existence of the virus, right? There would have been some shared agreement about the facts on the ground, and then we would have disagreed about, normally in sort of the political sphere, there'd be disagreement about, how big unemployment checks should be, or whatever the policies to, vaccine development, there would be disagreement. But things are different now, and the very existence of the virus and the character of the virus, these sort of verifiable facts, became themselves points of contention. And to this day, I think there are a good many people who are quick to scream hoax or fake news or whatever. So that strikes me as just altogether different from previous eras of journalism. And maybe I'm wrong, but how best to navigate and communicate fact in an era when fact itself is not as solid as it once was? Does that make sense?
Yeah, it's a difficult question. It's something we talk about a lot in my classes, kind of looking at what's been reported, how it's been reported, and then the follow-up after that, because information was coming so quickly, and it's really hard to take a pause. There's this balance between getting the information out there, knowing your competitor is going to be talking about it or writing about it, but then also being sure that you have vetted the information, especially if it comes from something as simple as a tweet. So we have to be really careful in that day and age. And this is something I'm a member of the Association of Healthcare Journalists, and it's a question that we posed to several of our own members recently. And a lot of people I think most of our members who participated in a survey said that they were experiencing challenges to getting accurate information and basically getting misinformation or bad information from what used to be trustworthy sources. So it's something that we're having to balance more frequently than in the past. And I think it's something we'll all kind of learn to do together. It's a new era, but I think the important thing is pausing and doing just as Sherry, Stroud, and Megan have talked about, pausing and looking at the information and really posing the question to people of authority about what they're doing and trying to get a diverse range of perspectives. And somewhere in there is the truth, but we have to cast a wide net to get more information in order to find it. And starting with the numbers, the actual numbers that we can find is a good way to start about that.
Stroud, speaking of numbers, has it been has it been difficult for you at all in this sort of new era, let's call it, where even hard data can become dubious to some readers. Some sizable portion of your readership, in some cases, might be primed to disbelieve what you're saying these days. And Stroud, you're sort of on the data beat. Has that been an issue for you?
Well, no, I'm not actually in the journalism school. I'm from the political science and economics school, so I wasn't. So like I can kind of look at that, but I guess. Sorry, I'm getting some text messages. I guess it's sometimes there's the old saying about there's lies, damn lies, and statistics, and I think you can pretty easily show statistics in a misleading fashion. You heard stuff early on about like, oh, the flu kills 60,000 people a year. And that's not exactly true. That's kind of on the high end of the spectrum. The CDC estimates that there's only been 1 year since 2010 that's been over 60,000. The other years have been below that. But on a fundamental level, it's very misleading. I mean, first of all, we didn't take nearly as many precautions like the lockdowns or the social distancing measures we did with the coronavirus. And also, just 60,000 people is a lot. And I don't think we can just brush that aside. I think what has been a challenge is when you're communicating these numbers, the numbers themselves are important, but it's important we don't just look at the numbers and we recognize that, when you see a death, someone did just, lose their life. And I think it's important that we remember the human impact that these numbers do have.
I'd like to speak on the data aspect of it too. I think as journalists, we kind of have this typical saying like, oh, like we don't like math, we're journalists. But in this, that speaks for me personally, but especially in this day and age, everyone needs to learn how to read data and interpret it. And I've worked with Stroud on that with these weekly UGA updates when they report their numbers. And we also had Stroud write an article about how we find the numbers because he keeps track of those every single day. And our numbers are different than what the Department of Public Health puts out. We calculated it a slightly different way. And I figured we needed to be transparent in that to make sure our audience knows that they are seeing a little bit of a discrepancy, and here's why. And here's how we get these numbers that we do and what that ultimately means for the campus and city community in terms of safety and how they go about determining things like a mask mandate.
Yeah, to sort of flip things and think about the reader or the consumer of news, what, with all that in mind, what advice do y'all have for, news consumers to sort of parse, the news, from all the sort of sources they'll get it. And these days that means, what your aunt posts on Facebook, all the way to the New York Times. What advice do y'all have for news consumers?
So I know as young people, we like to get our news from social media, but it's really become an echo chamber in this COVID era. For wrong information, for misinformation, for outlandish information. So I would say if you have one news source that you really like and you really value what they say, read that, take it with a grain of salt and find something from an opposing view or another publication and read that. And if they are both the same, like great, it's probably true and fair and accurate reporting, but always take it with a grain of salt and keep looking for other outlets. Don't just stick to one source or one social media site. Really diversify your media consumption.
Now I'll add to that because one thing that I noticed, especially at the beginning of the pandemic, and definitely on my own news feed of friends and family, is that people would just share anything. And I was having to go on and kind of do a lot of debunking of myths. And so I personally, ask my friends and family, like, please read the entire story before you share it. Be sure that you understand it, because once information is out there and once it gets circulated, it's really hard to rein it back in. And once it's in, people's minds and, in the conversation, it's really hard to stop it. So I personally ask friends and family to read the full story and check for things. Do they attribute where the information came from? Is there any conflict of where the information came from? If someone is telling you that sugary beverages are good for you and it's told by the manufacturer of sugary beverages, question that, right? So to read it and then to be a little more critical, particularly before sharing anything on social media.
If I can jump in for one
Sure.
second, I also see a lot of misinformation regarding coronavirus, and it comes from people of all political stripes, really. And a lot of the time, it's not malicious or anything. It's just, this is stuff where we haven't lived with before. This is stuff that, the scientists themselves needed to learn about because it was a novel virus. And all the data is just, and the information we're getting is confusing. So just, even if it's your friend who's, knowledgeable and they're not going to like try to mislead, just, it's important to verify it yourself before sharing.
And I'll also tack on a tip. So I think too, and we've noticed this as well, is that I think there's a greater emphasis on local journalism. So not a lot of national media outlets will come down to Athens. They'll ask if we could help them find sources and stuff like that. And I think there's like a growing emphasis on local journalism. And I'm not even just talking about the red and black. I just mean in general, like student journalism or like journalism in local small towns, because these are very niche issues affecting pretty niche populations differently across the country. And so like a lot of the reliable reporting that you're going to find about your specific case is probably going to be from your local news outlets, and maybe like national news outlets won't be providing as tailored information to you specifically. So I think that's something that I have noticed as far as the pandemic has started.
Yeah, that's all interesting. The one thing I guess I wasn't thinking about was, the way I sort of framed the question was as an individual reader by, herself or himself. But it's interesting to hear, how you can sort of, work in your, community, family, friend group to ensure that the right information or that information is sort of properly assessed. That sounds like really good advice. Do we, who worries that this sort of strange, almost want to call it like a postmodern sort of information environment where it's very kinetic and there's not the same solidity. In fact, like I was saying before, how much do we worry that this is the new, that the journalism world that y'all are entering is like, this is the new normal? Do we worry about that?
I am personally more worried about finding a job, but if this is, I think we're also in a very interesting time in that like politics were already very polarized before we even entered the pandemic. And so I guess like in a sense, we're kind of adjusting to a new normal. As far as the red and black, like sure, we have some people who are doubting or reporting, people on Facebook who are commenting mean things, but like generally the response is not like disproportionately negative. Like it's not like nobody is trusting our reporting anymore. We have like parents DMing us on Facebook all the time. Like, I think there is definitely concern that like this polarization and this like, I guess, like dishonest or like people not trusting the press is concerning, but I think we haven't seen as much of that in our own publication, or at least not to a point where like our message is not being conveyed at all.
And I would add that I think, as Sherry pointed out before, this creates new opportunities, particularly for local journalists and more specifically for print publications that have been struggling given the business models. But there's been a comeback under as COVID circulated, mainly because of what Sherry mentioned before, that people needed information in their community. It didn't matter what was happening. I mean, it mattered, but to people in Athens, they may care about what's happening in New York, but they want to know what are the hospitalization and death rates and infection rates in our local community. So I think it creates an opportunity there. But then also I see, oh, and I just lost my train of thought. I should write things down. But I think it's in general making journalists more creative because we cannot go out and do the kind of reporting that we are used to. We are finding other ways. And I think if you were just used to print or digital, you have learned some new skills, including video, recording, editing, that sort of thing. People are kind of more focused on data and understanding that. So I think it creates an opportunity through because we have to and to be more creative and to seek out unique opportunities to reach our audiences and communicate more effectively.
Well, and going back to Sherry and the importance of local journalism, I mean, the Red and Black, you might argue it's almost the paper of record in Athens now. It just, I mean, the sheer size of the staff versus the Banner Herald, which is a slowly sinking ship. And the flagpole is fantastic. And there are great journalists at both the Banner Herald and flagpole, but there's the work of the Red and Black has been incredible. And Sherry, I mean, as far as I can tell, you broke the Ana Cabrera story. Is that correct?
Yeah, that was like the last week of summer, I think.
Okay. Yeah. So, y'all, it's been exciting to see y'all, really assert yourselves as the,
For the audience who aren't aware of that issue, could you talk a little bit more about that story?
Yeah, so we had received a few tips a few weeks before that a housing employee had passed away. And we were not getting information from the university. Like Stroud was keeping track of university data every day. They weren't reporting deaths. So we kind of had the story in limbo for a while just because we couldn't get any solid information. And actually, I think it was Classic City News who had gone to the coroner and asked if Ana Cabrera had passed away. And so we actually filed a few open records requests and didn't get anything back. And then once we got the coroner, we had talked to her cousin. And I mean, still to this day, UGA hasn't reported that death or any deaths. And they had made it clear that, for whatever privacy reasons, that they weren't planning on publishing those deaths as they were with case counts. So that was kind of a big turning point. And still, we don't really have any indication of how many deaths have occurred in the university.
Wow. Maybe on a lighter note, are y'all ready for COVID to just be? I mean, everybody's ready for COVID to be gone, but the fact that it's infected, so to speak, like like Professor Rice was saying before. I mean, it's glommed onto every beat. Everything is COVID. Restaurant news is COVID. Business news is COVID news. It's all news is COVID news. I have to expect y'all are ready to turn the page on this.
Well, and I don't think it will end even if we get a vaccine, or when we get a vaccine and when it is over per se. There will always be COVID stories. I mean, so many businesses closed. And the football, the economic impact in Athens specifically, I think we'll be reporting about COVID for a long time. And I know student journalists are thinking to themselves, like, I want to be done with this, but if I go into this profession, I'll be reporting on COVID probably for a pretty long time. So I don't think it will go away entirely. There will always be COVID elements to other stories in the future. So we have to be prepared, I guess, to keep typing all caps COVID-19 for the foreseeable future.
Yeah. No, I guess it will be with us even after the virus itself is God willing, gone at some point. How do you feel that it prepares y'all for the profession? Versus versus non-COVID, a relatively peaceful early career in journalism. Have y'all picked up sort of tips and tricks and tactics that you feel you'll carry on into your career?
I think for me personally, being surprised when something breaks, or just kind of rolling with the punches, especially over the summer. We thought COVID would be over by August, and it wasn't. Then we had protests in Athens for racial justice, and then we had just a slew of other things just come down the pipeline. And so just being able to manage that and delegate and taking the time to process it, but then going out and getting that story and making sure that we're reporting on it. So I think just kind of being aware of all the things that could go wrong, kind of can go wrong, and they have. But how do you deal with that? How do you help your staff through that situation? And just kind of creating an environment that, like, okay, we're going to get through this, and we'll be able to give our audience the most important information that we can during that time.
I'd also like to add, I'm sorry.
No, go.
I'd also like to add, I think, and this kind of ties into that last question of like whether or not COVID will be over. I think, like, for us as journalists, COVID was a really pivotal point in kind of illuminating a lot of the inequities in our college towns and within the college communities that people weren't aware of before. And like, as far as the Red and Black goes, like, we had a lot of work to do on diverse coverage. And like, when you have a pandemic that's affecting literally every community in Athens, and on top of that, disproportionately affecting certain racial groups, you have to like open your eyes, and you're kind of forced to be aware of these issues. So like, in that sense, like, COVID reporting won't go away because it's kind of ingrained in us now, hopefully, that we're covering all of these communities in a fair manner that we hadn't before, and hopefully in our future reporting and like in our professional careers, like, our reporters bring that with them. Maybe it's just a city council meeting and like one policy was passed or something, but like looking at the effects on all the communities of that policy is something that we hadn't done much of before either. And so like, having this pandemic that affects virtually everyone and different people disproportionately, I think that was really, really a waking point for a lot of our staff.
How about you, Professor Rice? How has it or has it altered the way that you teach?
Oh, well, just like the red and black, my class switched gears pretty quickly at the end of last semester. So, I had given them the opportunity to look for things that they wanted to write about, and then we were going to pursue those over the course of the semester. And then we stopped everything and started reporting just on COVID-19. And one thing that I tell people who are interested in taking the health journalism classes is that it's always going to be a beat that affects everybody. I'm looking at the US Census Tracker, which says the population of US is about 330 million people, and the population of the world is just over 7 billion. All of those people are going to have an experience with the healthcare system. So I think what COVID is doing is giving everyone a crash course in this beat, so that they're not afraid of things like data, of laws like HIPAA. They will understand what those things mean. And I think that translates to kind of any other beat that you might cover. Yeah. Plus the idea that you have to switch gears really quickly, that happens in news. So, yeah.
Yeah. Yeah. And somehow everybody has to, there'll be, I mean, we're in election season now, so there's one more, bunch of news that has to be, glommed onto what's already going on. Y'all had said, I guess it was it Sherry who said that y'all had not received as much in the way of pushback from dubious readers. Is that correct?
Well, I wouldn't say not much, but like,
Oh, okay.
Proportionately with the number of people who have reached out, like asking for help or asking for tips or like asking us to look into things, I think in that sense, like it hasn't been like overpowering.
Okay.
But there is always the occasional Facebook commenter or person in our news tip that might not be as kind.
And then speaking of social media, there's also the you had mentioned Classic City News, which is a fairly new there has like Professor Rice has said, there has been this new maybe a small renaissance in local news. We have Athens Politics Nerd, Classic City News, these sort of new smaller ventures that have been really, really helpful. And then you have on Twitter, I'm sure everybody knows Ariana, which is sort of a new phenomenon. I wonder how y'all think about that sort of thing. Not her in particular, but people who serve as sort of a clearinghouse for leaks. But they don't necessarily abide by the same journalistic ethics, and rigor that y'all do, but they are still performing a news function. What are y'all's thoughts on sort of on that sort of stuff?
So at the Red and Black, we have to get people on the record and tell stories with first person accounts with names and fact check and back up the information. And so Ari provides really a great service for us by being able to report on these stories and broadcast them out into the void that is Twitter. And then we can follow up with a particular person or a group or Ari herself to find out more information to try to get the facts and the accuracy that we need to publish a piece.
Oh, that's interesting. So y'all have been able to follow up on news that she, breaks, for lack of a better word, and then y'all pursue it.
Mm-hmm. Yeah, okay. And so that's also how our news tip function works. We'll receive tips from our news email and then take those and kind of run with it and see where a story leads.
Okay. Professor Rice, You seem you have brought some helpful websites, I believe.
Yes, absolutely. There's a few things I think that have been that may be helpful for the students. I mean, but they're already doing amazing things. And just some examples of how journalists have kind of had to get creative. So I'll just quickly share my screen and see if I can share those with you. If you give me 1 second. Where is it? Let's see. A resource that I encourage for anyone covering COVID. This is the website for the Association of Healthcare Journalists, of which I'm a member. And one thing that they offer, in some cases for free, under our core topics on the right-hand side, is some understanding of COVID-19. And there are resources in terms of local experts, data, and that sort of thing. So I encourage people to check it out. There are webinars and weekly information on how to report on certain aspects of COVID-19, which really helps us reduce the amount of misinformation, especially for those who have never studied health journalism or health or science journalism. But the other thing I wanted to point out, just as Stroud has done with the red and black, other outlets have done. So this is the COVID tracking project from the Atlantic. And what they tend to get behind the data in a very similar way as, move to this other one, Johns Hopkins, which people were using in the beginning. I think people quickly realized that there were some downsides to strictly going with the data that had been reported from the federal government or the state government. And both of these trackers use a consortium of data from hospital records, from state things that were already being tracked, from ICU beds and that sort of thing. So both kind of show how both on the academic side and on the journalist side, the knowledge in terms of using and tracking and acquiring data was very necessary. And most of the newsrooms that I have worked in over the past few years, from CNN to Modern Healthcare to the Dallas Morning News, have data experts on staff to work with reporters to share information, to gather data. So there's no need to fear it, but you have to try it and you have to be willing to explore it.
Great, thank you. That's super.
But then, as Stroud pointed out, behind every number is a person, and the real task for the journalist is finding that story, that anecdote, the human element that really helps put it in perspective for the rest of for the audience, rather.
Well, great. Thank you all. I think this wraps up this portion. And if Chandler is ready, we are going to do a Q&A section to close things out.
We have some questions through the chat, and I'll go ahead and just read the most recent one verbatim. It's a really good question, kind of more experiential. So I'm curious what it's like in the newsroom right now, or lack thereof. Is it difficult to come up with story ideas? Do you have too many to count?
Yeah, so there definitely is not a newsroom right now. The news desk and all of our desks individually meet, and then we have weekly meetings with our editorial staff, all virtual. Most of us are still in Athens. So it looks different for sure. And then we also do, we produce a special issue, a hard copy paper once a month. And so some of the editors will go into the office, socially distance, and meet to produce that. In terms of stories, the first month was extremely overwhelming because we had to gather our staff and sit down and say, here are all of these stories that have currently been going on that we need to cover within this amount of time because they're extremely important and relevant. And we are never lacking for ideas or subject matter. And especially as we turn this point towards the election. We're gearing up for that now too. And so it's just been balancing all the different news, because what's different this semester is we have like, okay, your regular campus news, whatever used to be news, and then now add all of our COVID style news as well. So we definitely have more news stories than writers at this point, but we are in the process of recruiting a lot. So yeah, it's been crazy, but we are never short of ideas or stories.
I'm curious, and this is for Sherry and Stroud as well, but in the newsroom, when you have lots of ideas, how do you make decisions about what gets included and on the front page? How does that decision making work?
I guess there's, I guess like the idea of a front page has kind of collapsed a bit, given the lack of papers. But like the way they do the papers now is that there is a special edition each month. So in that sense, like that is just based on whatever theme it is. So they did football last time, and the first one was just about COVID. But the other aspect is like whichever stories are digitally sound or digitally appealing, which is probably something that we haven't thought as much about in previous semesters. But I worked as digital managing editor over the summer. So like a lot of that was like figuring out which stories we can pull other multi-platform elements into it. So in that sense, like other people have been saying, this has been a really good time for experimenting and like for our writers to kind of think outside the box, to think which stories will look best on our digital homepage, as opposed to like A1 on the paper.
I think, like Sherry said, we do have to kind of decide which ones are the most important to cover, and you know, what we put on our podcast, what we put at the top of the website, and that can get kind of tricky. Sometimes it's very obvious, like when UGA saw a huge spike in cases, that was obviously like the big story of the week. But other times it's not as clear, and I think one of the challenges, especially as we are talking about how are we covering different communities, is making sure that we have different perspectives on what we need to be focusing on.
Well, we have a little bit of time left, and I'm not seeing actually, no, there is one more question. This gets really into the mechanics of reporting. So how do you approach people with a mask? Are people okay with strangers walking up to them? You know, these are kind of, might seem small, but they end up being big issues that might impact the way you do reporting.
So we established over the summer and continued it into the fall that if you do report in person, you should try to stay 6 feet away and you're required to wear a mask. And so we've kept that mentality when we covered protests, when we've covered other events that have happened virtually. So yeah, we mostly just tell our writers to wear a mask. And if you don't feel comfortable going out to report something, let us know early so we can either find a replacement or find another way to report on that story. And yeah, if you don't feel comfortable, then you don't have to go out or approach that person specifically if they're not wearing a mask.
We've also reached out a lot on like social media. And like you can DM people or just send out like a general tweet or something. And I think, I mean, it was a surprise, at least for me, because I'm not from journalism, but people tend to be a lot nicer than you might imagine. Most people are probably they'll say yes, or they'll very politely turn you down. So it's not as scary once you get the hang of it.
And for classes, I mean, we set up some really strong reporting guidelines for students here, you know, for campus this semester. And those include, similar to what Megan said, you know, staying, you know, 6 feet up, at least 6 feet apart from people that you're interviewing. But then our students also have to report to us before they go out if they need to meet someone inside and kind of one-on-one. So we're discouraging that this semester, particularly, and probably into the next semester as well. But I mean, as Stroud pointed out, people are generally nice. I think the challenge for reporters is just explaining who you are and being clear about your intentions with what you're going to speak to them about. But I think, you know, you can say hello to someone from 6 feet. But for our students this semester, we prefer they keep those conversations outside of a building and at a social, in a socially distant manner.
Well, thank you all for that. That ends the chat question, but we have about 2 minutes left. So I was wondering if I could sneak one more question in, if you could all, and maybe do this as briefly as you might be able to. If somebody, if another student showed interest in journalism, what would you tell them right now? What kind of advice would you give to them about whether they should jump into this field, and any kind of encouragements or hazards you might offer them?
I would say if you're interested, get involved early. Within Grady and at the Red and Black, there are tons of clubs and organizations that you can get involved in, even if you're not in Grady. So don't shy away from it. Jump right in. Get your experience in early as you can.
As someone who has been very indecisive in college, like I'm not a journalism major, I'm EMSC major and IA, and I just happened to be at the Red and Black my freshman year. So I think like it is what you make of it. So, you know, you want to come here and focus on STEM related issues and you're not in Grady or even like close to it, then like go ahead, like come over. If you're interested in comp sci and like web design, I mean, like we always need help in that sense as well. So you know, like maybe you're not interested in writing and you want to try out video, like we also have room for that. So I think it's more than people probably see it as, and especially as we're moving to more digital, we have a lot more opportunities in that sense.
I personally never thought I was going to go into journalism. I kind of just applied to the Red and Black on a whim, to be honest, but it can be pretty stressful at times. There's no way around that, but I think it can be pretty rewarding to know that, you know, you're able to help out your community during these stressful or these times. I think that's been something that's kind of kept me motivated, at least.
And Professor Rice, you want to give the last word on encouragements or warnings to potential?
I would second Stroud's warning. I think a lot of people think, oh, it's just media. That's an easy job. And I think Stroud, Megan, and Sherry would would agree that that is just not true. It's hard work, but it's very rewarding. For me personally, I am passionate about journalism. I see the need and impact that it can have on our society. So I encourage anyone who wants to try it out, like come have a conversation with us, right? Like learn a little bit more about it. In terms of, you know, for me, it's kind of changed how I approach everyday things. I mean, when I bought my house, I'm sure my realtors and brokers were really frustrated because I poured over every single detail and I came with a list of questions that was like 10 pages long. But it made me a smarter consumer at the same time. So I encourage people to think about kind of the value that it will add. And it's a great profession.
Some wonderful advice from our panelists. So before we close, I just want to say thanks to everybody for being a part of this. Thanks to Matt for organizing. Thanks to Professor Rice, Sherry, Stroud, and Megan for being awesome panelists. And I want to close with a quick quote from one of our chats. So somebody said, "You all doing a great job. Athens residents appreciate what you're doing." So take it to heart that, you know, people are really being impacted in the community on campus by what you're doing. So great job. All right. Well, thanks, everybody. We're going to go ahead and close the panel. Have a great one. And thanks a lot for the good conversation.
Thank you.
Bye.